Imagine this for a moment. You go for a routine checkup. You feel fine, no pain, no warning signs. Then your doctor looks up and says, your blood pressure is high. And just like that, you're told you may need pills, possibly for life. But here's the question almost no one asks. What if high blood pressure isn't a life sentence? What if, for many people, it can actually be reversed? High blood pressure, or hypertension, affects more than 1 billion people worldwide. It's called the silent killer because most people feel completely normal while their blood vessels, heart, kidneys, and brain are slowly being damaged. And the usual message people hear is simple. Once you have high blood pressure, you'll always have it. Take your medication, manage it, and accept it. But modern cardiology research tells a more hopeful story. Let's be very clear from the start. This is not about quitting medication on your own. And it's not about miracle cures or internet myths. This is about understanding what actually causes high blood pressure in the first place and what science shows can truly bring it down, sometimes even back to normal levels. Blood pressure is not random. It's the result of how hard your heart works and how narrow or flexible your blood vessels are. Over time, poor diet, excess salt, insulin resistance, chronic stress, lack of movement, poor sleep, and excess body fat slowly change the structure of your arteries. They become stiff, inflamed, and narrow. The heart has to push harder. Pressure goes up. Here's the important part most people never hear. If high blood pressure is caused by lifestyle-driven changes in the body, then changing those same factors can reverse much of the damage, especially in early and moderate hypertension. Cardiologists see this all the time. Patients who transform how they eat, move, sleep, and manage stress often see their numbers fall steadily over months. Some reduce medications. Some come off them under medical supervision. One of the biggest drivers of high blood pressure today is excess sodium combined with low potassium. Our ancestors consumed very little salt and a lot of potassium-rich foods like vegetables, beans, and fruits. Today, processed foods flood the body with sodium while starving it of potassium. This imbalance tells your kidneys to hold onto water, increasing blood volume and pressure inside your arteries. When people reduce processed foods and start eating real, whole foods, blood pressure often drops within weeks. This isn't theory. Large clinical trials like the DASH diet studies showed significant reductions in blood pressure, sometimes comparable to a single medication, just by changing what people ate. Another powerful but underestimated factor is insulin resistance. When your body struggles to handle sugar and refined carbs, insulin levels stay high. High insulin causes the kidneys to retain sodium and activates the sympathetic nervous system. The fight or flight response, keeping blood pressure elevated all day long. This is why people with prediabetes or belly fat so often develop hypertension. When people cut back on sugar, refined carbs, and ultra-processed foods, insulin levels fall. As insulin improves, the kidneys release excess sodium, blood vessels relax, and pressure comes down. This is one reason weight loss, especially around the abdomen, has such a strong effect on blood pressure. Even losing 5 to 10% of body weight can lower systolic blood pressure by 5 to 10 points. That's not minor. That's the difference between being labeled hypertensive and being back in the normal or near normal range. Movement is another key piece. You don't need extreme workouts. Regular walking, light strength training, and gentle cardio improve the elasticity of blood vessels. When arteries become more flexible, blood flows more easily. The heart doesn't need to pump as hard. Over time, resting blood pressure drops. Cardiologists often say this: exercise is medicine for your blood vessels. And like medicine, it works best when taken consistently, not occasionally. Just 30 minutes of brisk walking most days of the week can lower blood pressure as effectively as some drugs. But there's something just as powerful that many people ignore: stress. Chronic stress keeps cortisol and adrenaline elevated. These hormones tighten blood vessels and increase heart rate. If your nervous system never gets a chance to calm down, your blood pressure never truly rests. People are often shocked when simple breathing exercises, better sleep, and daily stress reduction practices lower their blood pressure readings. This isn't mind over matter. This is physiology. A calm nervous system directly signals blood vessels to relax. Sleep, too, plays a major role. Poor sleep increases inflammation, disrupts hormones, and raises nighttime blood pressure. Over time, this leads to consistently higher daytime readings. Fixing sleep alone has helped some patients lower their blood pressure without changing anything else. So here's the truth that deserves to be said clearly. High blood pressure is not always a permanent condition. For many people, it is a signal, a warning light that the body is under strain. When that strain is removed, the numbers often improve. In the next part, we'll go deeper into exactly which daily habits make the biggest difference, what mistakes people make when trying to lower blood pressure, and how to tell if your hypertension is likely reversible. Now let's talk about what actually works in real life, and just as importantly, what doesn't. One of the biggest mistakes people make when trying to lower blood pressure is focusing on just one thing. They cut salt but keep eating sugar. Or they exercise but sleep 5 hours a night. Or they meditate but remain sedentary all day. Blood pressure doesn't respond well to half measures because it is controlled by multiple systems working together. The most successful approach is what cardiologists call a stacked effect. Small improvements in several areas combine to produce a powerful drop in blood pressure. Let's start with food because it acts every single day, multiple times a day. The goal isn't perfection, it's consistency. When people shift their meals toward vegetables, legumes, nuts, seeds, fruit, lean proteins, and healthy fats, something important happens inside the arteries. Inflammation goes down, nitric oxide production improves. Blood vessels widen naturally. Potassium deserves special attention here. Foods like spinach, beans, lentils, avocados, sweet potatoes, and bananas help counteract sodium's effect on blood pressure. Many people are deficient without realizing it. Increasing potassium from food, not supplements unless prescribed, can significantly lower blood pressure in a safe, natural way. Magnesium is another quiet hero. It helps blood vessels relax and supports healthy nerve signaling. Leafy greens, nuts, seeds, and whole grains are excellent sources. Low magnesium levels are strongly associated with hypertension, especially in people under chronic stress. Now, about salt. This part confuses many people. Salt itself is not evil. The problem is processed salt in processed food. When sodium comes packaged with refined carbs, unhealthy fats, and preservatives, the body reacts differently. When sodium is part of whole foods, like soups made from vegetables and legumes, the blood pressure response is much milder. Instead of obsessing over salt, focus on eliminating packaged and fast foods. Most people automatically reduce sodium by 30 to 50% just by doing that. Let's move to physical activity. The best exercise for blood pressure is the one you can stick with. Walking is incredibly effective. It lowers resting heart rate, improves insulin sensitivity, and reduces arterial stiffness. Light resistance training is equally important. Stronger muscles improve glucose handling and reduce strain on the cardiovascular system. One common myth is that people with high blood pressure should avoid strength training. Slow, deep breathing activates the parasympathetic nervous system, the body's natural relaxation response. Now let's talk about expectations. Blood pressure does not normalize overnight. This is where people get discouraged. The body needs time to repair blood vessels, reset hormones, and calm the nervous system. Most people who succeed see gradual improvement over 4 to 12 weeks, with continued progress over several months. For many people, medication provides protection while lifestyle changes do the deeper healing work. As the body improves, medication needs may change, but that decision is always made with a doctor. There's also a genetic component. Some people are more salt sensitive or stress sensitive than others. That doesn't mean reversal is impossible. It simply means the margin for error is smaller, and consistency matters more. The most encouraging thing cardiologists see is this: when patients truly understand why their blood pressure is high, they become empowered. Fear turns into control. Numbers stop being mysterious and start becoming feedback. In the final part, we'll bring everything together into a clear, realistic path forward. Talk about who is most likely to reverse hypertension, and when lifelong treatment may still be necessary. And learning how to listen to that message is often what changes everything. Their hypertension was discovered early or is in the mild to moderate range. They are willing to make steady, realistic lifestyle changes instead of chasing quick fixes. And they monitor their progress, not obsessively, but consistently enough to notice patterns. Home blood pressure monitoring plays a huge role here. Measuring blood pressure at home at the same time each day, while calm and seated, gives a far more accurate picture. And they improve overall quality of life far beyond blood pressure alone. High blood pressure does not mean your body is broken. So instead of asking, "Will I have this forever?" a better question is, what can I change today that helps my body feel less under pressure? That might be a walk after dinner, cooking one meal at home, going to bed 30 minutes earlier, taking 5 slow breaths when stress hits. These small actions don't feel dramatic in the moment, but over time, they quietly reshape your cardiovascular health. Modern cardiology no longer sees hypertension as a one-size-fits-all condition. It's dynamic. It evolves. And in many people, it improves when the underlying causes are addressed.